of the FDA-approved therapies for pulmonary arterial hypertension, they target one of three pathways. Endothelin, more specifically endothelin 1, is produced by the body, and it causes the blood vessels to constrict or narrow by acting on the vascular smooth muscle cell that's in the wall of the blood vessel, causing it to tighten up. So the idea is to block the effect of the endothelin on the blood vessels, on the vascular smooth muscle cells specifically, allowing them to be more open so more blood flow can go through the lungs so the heart doesn't have to generate as high a pressure against that resistance, so the heart can function more normally and the patient has less symptoms. So there are three medications that are FDA approved in that pathway that block the receptor to endothelin on the vascular smooth muscle cell. They're called endothelin receptor antagonists. So there's bosentan, macitentan, and ambrisentan. A second pathway, and one that we probably understand the best because historically it's been the area of focus and the area for which we've had medication the longest period of time, is the prostaglandin pathway, or the so-called prostanoid pathway. And these agents are also produced by the body, but they open up blood vessels and help keep them healthy. So you want to try to reproduce that effect in the body by giving a medication that acts like a prostaglandin or is a prostaglandin, or acts on receptors and produces the same effect as the prostaglandin. The third and final pathway is nitric oxide. Some folks get this confused with nitrous oxide, which is laughing gas. It's not the same thing. Nitric oxide does open up blood vessels, and there are a variety of medications that are approved in this pathway. The two ways to impact nitric oxide is to increase production. So the real Sigwat that I had mentioned earlier as being approved for group 4 chronic thromboembolic disease stimulates a pathway that increases the production of nitric oxide, the soluble guanylate cyclase pathway. The other medications block the breakdown of nitric oxide. They're called PDE5 inhibitors, and they include sildenafil and tadalafil. So they keep whatever nitric oxide the body has produced around longer, opening up blood vessels. I will say that really, probably, the long-term benefit of all three of these targeted pathways is what we call anti-proliferation effect. It helps to heal the blood vessels, which have been scarred to a certain extent or changed morphologically to a certain extent in the disease state. It helps the vessels to go back toward a more normal anatomy, a more normal physiology, and a more normal functional state. So it isn't just the immediate effect of vasodilation, opening up blood vessels. It's this anti-proliferative benefit that's very important, and why the patients are generally on medication indefinitely.